Well, it's now 6 p.m. If we're ready to go, Ms. Clerk, I will call this meeting of the Cunningham Town Board to order.
Ms. Wu,
Here.
Mr. Evans,
Here.
Ms. Hersey, Ms. Colasetti,
Here.
Ms. Bishop,
Here.
Ms. Wilkin,
Here.
Mr. Quisenberry,
Here.
Mayor Marlin,
Here.
Ms. Chenoweth,
Present.
Mr. Williams. Thank you.
Thank you. I would note it's Monday, February 14th, 2022. Next item on the agenda is approval of the minutes from January 10th, 2022. Is there a motion for approval?
I'll move to approve minutes from January 10th.
I'll second.
Moved by Chandra, seconded by Mary Alice. Any substantial corrections? Okay, will the clerk please call the roll? I'm sorry, will the clerk please
Okay, Ms. Wu,
call the roll?
Yes.
Mr. Evans,
Yes.
Ms. Colasetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry.
Yes.
That motion passes. Are there any additions to the agenda? Okay. Next up is public participation. If you'd like to address the Cunningham Town Board, please raise your hand. Okay. I don't see anyone's hands raised. All right, we'll move on to committee to verify bills, the town fund and the general assistance fund.
Yes, and I just want to know Claudia Lenhoff from Healthcare Consumers is in the audience, and I'll be asking her to join as a panelist of the first item of new business, just a heads up. So this past month, we had $58,304.61 in the town fund, expended from the town fund, and we had $112,705.67 expended from the general assistance fund. So the total in expenditures was $175,967.33, and I will give the rest during the officer's report. Any questions about the bills?
Mary Alice.
Yeah, I was looking at the bills and I noticed that there is Heart Technologies on here that we spent about $5,000 on. Would you be able to provide some more details on that?
Absolutely. So they're our security provider for the new properties. So we installed security cameras throughout those properties as was planned for.
Okay, so those are, sorry, go ahead.
Oh, they're a new provider in town. I think most people are familiar with Hefty-Moran, but we did a bidding process and we selected Heart.
And is that that like an installation and or is it reoccurring?
No, it's not recurring. It's mostly one-time expenses. It is 2 servers, one for each building. The security cameras, which essentially are 360 around the outside perimeter of both buildings. And there was a number of wires that needed to be run. The internet connection, which would be the recurring expense, was actually donated by Volo.net. And so we will not have a recurring expense for internet going forward. And I do not, except for if something breaks and we have a Heart come out and address the faulty issue, there's no recurring expenses or maintenance fees related to this.
Okay, thank you.
Any other questions on the town fund or general assistance? Okay, could we have a motion to approve both, please?
I'll move approval of the bills.
Is there a second?
I'll second.
Moved by Mary Alice, seconded by J.S. Any further discussion? Will the clerk please call the roll?
Mr. Quisenberry,
Yes.
Ms. Wilkin,
Yes.
Ms. Bishop,
Yes.
Ms. Colacetti,
Yes.
Mr. Evans,
Yes.
Ms. Wu.
Yes.
That motion passes. Reports of officers.
I'm going to go ahead and share my screen for this section. Let me see if I can do that. Yep, it looks like I can. Can you see an infographic before you?
Yes.
Okay, great. So this is, I also just sent it to the town board members in your email, and this is going to go out on in a blast to our listserv and on our website. Essentially, thanks to our intern, Jack Mazka, who is doing a capstone with urban planning in our office. He helped to produce this year's infographic. At the end of each calendar year, we've been trying to put together data for that calendar year. We also track things by fiscal year, but the calendar kind of wraps up the year for us. And so we were able to count 10,705 people served in Urbana in 2021. You can see for general assistance, we served 282 households, and you can see the total was about $340,000. Rental assistance was at $90,658, and we served 78 households. And then we, as you know, we run emergency housing that has served in 2021, 28 adults and 42 children. These are all children in Urbana School District or staying at Crisis Nursery. For subsidized housing, we worked hard in 2021. We had 59 households move into subsidized housing, whether that was through housing vouchers for the homeless or seniors or people with disabilities who moved into some of the openings at project-based voucher locations like Steer Place. We also launched a program to provide housewarming gifts to furnish apartments for homeless residents, and we did 25 housewarming gifts. With disability support, 21 of our participants received SSI support last year, which is fantastic, and 15 were awarded SSI payments. So 21 were helped in the application process, and 15 were awarded SSI payments. And there are delays. The ones awarded are probably counted from the year before as well, because it's a multi-year process to get on disability. In terms of food support, which is something we launched during COVID, with our partners Channing Murray Foundation, Sola Gradia, and Solidarity Gardens, we delivered 699 food buckets to 1,264 adults and 850 children. These are all Urbana-based residents or people with children in Urbana schools. With Solidarity Gardens, we counted 3,835 pounds of produce that we produced just through the Solidarity Gardens initiative. That produce is then distributed through our Bucket Brigade collaboration, as well as used for the fresh food that we were providing meals for. We started just in the middle of the year providing annual bus passes again, since MTD started to charge, and we provided 80 of them, whether that's through dash passes, where we help people apply for that entitlement, or through actual provision. So grants to social services, we gave, and of course, we have a fiscal year process, so we counted last fiscal year in this case. 8 organizations received $118,000, and in their reporting, end of year reporting, it shows that they served 6,382 Urbana residents in that program. So it's an important and robust service to extend the services of Township. Utility support, we provide utility support when people are facing shutoffs or are shut off. We support it, and we do that throughout the county based on private donations we receive primarily through the faith-based community. We supported 89 households and did about $38,000 in utility assistance. And we launched a digital inclusion campaign, and we distributed 12 laptops, 18 internet connections, and 113 phones were distributed. And that laptop connection is in partnership with PCs to People and the Community Data Clinic on campus. So I just wanted to show, kind of preview before the public season, the good work that the Township did during 2021. Any questions about that before I jump to the supervisor's memo? Okay. Oops. Okay, great. So I will then just give a review of this last month, Valentine's Day edition. Nice artwork by Ricardo Levins Morales, who's based in Minneapolis. It's a plug for Ricardo. The general assistance, we are currently at 61 participants. If you look at our numbers of homeless residents, we are just going down, down, down every month. So we are down to 7 of our participants are homeless. That is because in most cases, we've been able to move our homeless participants into housing, much thanks to Pinewood. And we'll see the numbers in a moment with the Pinewood development that's made a huge dent in that, as well as the COVID vouchers. And you can see that we're serving 38 males, 22 females, and 1 transgender resident. We have 1 person, so we've launched our education employment track. I'm hoping that we could do a presentation of the track manager. We've reshuffled our staff, and so I have a new track manager over education and employment, and I'm maybe asking her to come and present to you. But right now, we currently have 1 participant who's enrolled in online classes, and then 3 who are approved searching for educational opportunities. So they go through pretty intensive kind of intake process to see what their current status is in terms of educational attainment, figure out what their goals are, and then we help them through the application process and pay any fees. That's the short version. You'll get a more robust picture of it in the future. With the disability and wellness track, you can see the number of participants awarded and how many you have supported. Essentially, transportation assistance, I spoke a little bit about that. We continue to do vaccination assistance. We've expanded it to all participants. So we just started with general assistance, but we decided to expand that essentially to our emergency housing participants, our rapid rehousing participants, outreach, and we are now paying $25 for each child. So, you know, there's a number of people in the household that can give $50 per adult and $25 per child for completed two shots of vaccination. And we've mailed letters and done follow-up calls thanks to our new social work intern, Abby. And so far we're at 41 participants out of 99. So we continue to track support on that. Rental assistance is going up. We're seeing an increase in rental assistance now that the emergency rental assistance at the county stopped taking applications on the 3rd. Actually, they extended it to the 6th past the big blizzard. And so we are also working with the Bridgewater Sullivan Community Life Center. They continue to do rental assistance and we do rental assistance. So we track people based on appropriateness. With housing advocacy, we continue to help people move into subsidized housing, and we're running at about 35% success rate, which is great. So we've gotten 61 households moved into housing. And you can see with Pinewood, we made 13 referrals and 7 of them are housed in Pinewood. So that is super. The Housing Authority, we continue to make referrals. We've made referrals for the emergency housing vouchers. That essentially that list is closed until there are further openings, but we are helping people who we originally helped to refer and package their applications to locate and move into housing. And there's quite a bit of work involved in helping people locate housing and move in. And then of course we provide the housewarming gifts. Bridge to Home is the name we now have for our homeless continuum of services. I'm very proud to say that of the 36 residents who were actively unsheltered prior to the opening of CU at Home's Low Barrier Shelter, during this winter storm, we did intensive outreach. We had gotten essentially everyone into the shelter. There were just a few folks who were choosing for various reasons not to go into the shelter, oftentimes to stay with their partner. And so we found 12 individuals who were unsheltered right before the storm. And we put 2 of them in the hotel through the week, and 9 moved into shelter, and 1 person chose not to shelter, although my understanding is that in the middle of the night, he did seek shelter. Emergency housing, we had 7 individuals sheltered in hotel. So we do have ESG funding to shelter folks in a hotel. We do support people who are medically fragile. We are seeing an increase in discharges from Carle Hospital of folks who I have concerns about whether or not they should have been discharged. They have significant medical issues. So we are doing some housing, working with See You at Home on that. We did house several folks who did not want to go to the shelter because we were concerned about them freezing during the blizzard. And then we continue to, we have myself and my program director on the low area shelter steering committee. And essentially that program at See You at Home has reached capacity, but they opened their conference room to house overflow and we're asking for volunteers. So I'm not aware of turnaways based on being full at that shelter, which is great. We continue our rapid rehousing program where we provide 12 months of rent for literally homeless individuals and families. They have to be referred through centralized intake. And we have 6 households that are in that program right now. And we have several referrals coming in. Emergency housing for Urbana families, those are specifically in our properties. We've served 40 to date. And last month we served 6 households. We had 4 new families move in. It was quite a whirlwind. We have 15 children that are currently being served with housing. So with utility support, we continue to, Ameren is no longer doing shutoffs because of the temperature, but we do see water bills that are threatened for disconnection. So we had 2 households help last month, both for water. We continue to track eviction and are working closely with the court system and RPC. RPC is actually, it's not on this because it was just announced after I did the memo, but RPC has a new pot of funding to support people who are in a court-ordered eviction process to help with rental assistance. So that is great news because we were concerned with the end of the countywide rental assistance program, how we would kind of intervene in the court system. That's been an important tool. So that will continue. You can actually see all the first appearances. Essentially, you can see a high number in October of 49. And then, it inches up and down. So it's in the 20s right now in terms of weekly first appearances. Our digital inclusion campaign, we did have to interrupt a couple of events we had for January due to the COVID spike. We didn't feel that it was safe to have indoor activities. So we are now looking to reschedule those in February. And Bucket Brigade is currently, we continue to, Channing Murray delivers 15 to about 15 Urbana households per week. We had a number, 229 neighbors helped last month, and there is a call for volunteer drivers. So anyone who would like to help out, the information is on this, and you could also call our office and we can direct you. But they are looking for volunteer drivers, multilingual, English speaking, to be great. I wanted to put in a few pictures of what it looked like because we actually ran out of coats last month and it was a dire situation. We asked for coats and I want to show you what the picture looks like. Here, let me make this bigger. It is just really amazing how our community comes together when we make the request. So we were deluged with coats. We are now asking, because we have enough winter gear, certainly we'll continue to take coats if you have them in the back of your car and have been planning on dropping them off, but you don't need to dig in your closets. We're now operating a diaper fundraiser. That's an important need for our Bucket Brigade. Anyone who would like to donate for diapers can either give to our Angel Donor Fund or actually donate the diapers at the front door or in the bucket in front of the front door at Township. And Solidarity Gardens this month was really focused on, we held a 3-week retreat. So we met for about 6 hours. And then we also met in committees, and we're really intentionally planning this year to increase production and engagement. We've launched an affiliates program. That affiliates program will have funding attached to it, so affiliates can actually apply for funding. This will be important for gardens like Learman Avenue in Urbana, which has at times struggled, with, I think they had their shed eaten out by a rodent at some point. They were missing some tools. They had various needs. And so that's one of those things where a little bit of money would go a long way to enable volunteers to grow food. So we're hoping to get submissions this spring for the affiliate garden program. And I'm happy to answer any questions that you have.
Mary Alice, and then Christopher.
Thank you for the report, Danielle. I was wondering for the Pinewood location. So I know that those are people who are waiting on SSI. Are there any other qualifications that you have to meet?
Yeah, so Pinewood it's essentially got, I believe there's 24 units and a portion of them, I believe is 5, is set aside for the statewide referral network, and 19 are set aside for folks who do not get disability payments, but are working with a township in Champaign County to get general assistance and get on disability. So there were referrals, I think all of the referrals came from either us or City of Champaign Township, but the other townships could have participated. So they're pretty, statewide referral network. That is basically a network that's set up where referrals go through the state, and you have to be homeless or meet certain criteria, which can include having a disability, but having SSI. So if they go through the statewide referral network and if they're receiving SSI and they come to us with that need, we can refer them through the statewide referral network. And we just did another training last Friday on some of the updates to that system. But we work closely with the state in trying to make those placements throughout Champaign County, and that's one of the placement sites.
Thank you.
Chris.
Yeah, Danielle, thanks for the presentation. On the eviction hearing statistics, are those the number of evictions or just the number of cases that you've seen going through the system?
That's a great question. It is not the number of evictions. So the issue with evictions is that we can't get access to the information about actual evictions because of the eviction ceiling law at the state, which I think was an unintended consequence of that law, was that advocates can't quite access that information. So what we do have is how many had first hearings and then second or total cases heard that week. What I can tell you from talking to Kyle Patterson, who's our eviction prevention specialist, he's in eviction court every week, is that essentially about half of the people who come to eviction court are in the process of working on rental assistance. They have a rental assistance app. So what the judge has been doing is basically, if you already have a rental assistance app and you can make one at eviction court, we will help you fill out the application right there at eviction court. We go into a side room, we fill it out. So if you are actively pursuing rental assistance, the judge has shown generally will move that to a mediation process. So there is a court mediator that is funded through the county, and the landlord and the tenant sit down and mediate at that point. And a lot of that is getting the landlord to wait on the rental assistance payments. And then the landlord may have other concerns about the tenant. And so that's an opportunity for he or she to bring up those concerns. So it does require both parties to participate. And we'll get to that shortly in the source of income discrimination resolution before you, because that resolution covers two things. One, it says you can't discriminate based on source of income, which you can't in Urbana. But it also says that if you get COVID rental assistance, the landlord has to accept it. Like the landlord can't say, I'm just not going to take your money. I'm not going to take the state's money. I don't work with the state. I don't work on COVID. So that's an important piece. The landlord does have some discretion about whether or not they participate in the program. We have a couple of ways around that, and we do some landlord wiggling, and we haven't seen a whole lot of that, honestly, thankfully. But that is something that would be covered by the state law. So, yeah, so the answer to your question is 28 first appearances last week does not mean 28 evictions. I would hope that it would mean half or less of that, but I can't know for sure.
Thank you.
Grace.
Thank you. Thanks for the update and all this important work. It's all very important stuff. I think especially in the winter weather, it makes it even more in your face apparent of the urgency of this. So I'm so glad that we were able to have that extra low barrier shelter and, a few people out on the streets in this temperature it's a big deal. It's always a big deal, but this makes it even more in your face. So I appreciate that really important work and glad that those things were able to work out. I was wondering in the previous line about eviction court, if you could repeat or share a little more about, I think you mentioned RPC had a program coming that's, is that to help, you say with court fees, or could you that program more?
Yeah, so Regional Plan Commission was managing funds from the state through feds through the state that was for emergency rental assistance. Individuals also had the opportunity to apply directly for the state, but their chances were much lower. So we were really lucky in this county to have locally administered rental assistance, because frankly, the rates of success are just much higher. And then we, the township, layered on top of that process, township packaging people's applications. So every application we sent to the county was complete, which is why our success rate was so high for Urbana, is actually like double the success rate of Champaign. Not that I'm competing, but just to say it does matter when you have someone who can help you navigate services, which I think Claudia can speak to when we get to her piece. So essentially, let's see. What was your question? And I'm sorry, I'm looking at, you wanted to know about the new program. So the new program is a replacement for emergency rental assistance, which closed taking additional applications at the beginning of February, because they essentially think that most of their funding is guaranteed. They won't know. There may be another opening, but they didn't want to have people apply for funding that didn't look like it would come through. So essentially they got a different line item source of funding that will just be for folks who have they're in court in the eviction process. And this is really important because the RPC has played a huge role in supporting people at that moment, right? And they are also in eviction court and managing that process. So that program is for anybody who has got, they've got a notice to appear in court for eviction. And so we are sending anybody who is in that situation through that program. But most of the people come to that program through the court system. They get the notice to appear, but when they come to court, they find out about that program, or there are other ways. So that is really hopeful. Every single time we think, the funding has run out, something else, we scrap together another piece. It's not exactly what I would call the best approach to public safety. Imagine if we had to beg on the street for fire services every 6 months, but it is working because people are making it work. So we do have that piece in place going forward, and they will, use those dollars until they run out. RPC also has regular rental assistance dollars, just as they always have. So somebody who's not COVID impacted or not in the court system, who does not live in Champaign or Urbana, can also receive some rental assistance through that. So we continue to keep on moving with rental assistance.
Thank you. Yeah, that was another question I thought of too that I think you answered, is what are people applying for when, they might start an application in court? And you're saying there's other options besides that one emergency rental assistance that's ended. Is that right?
So there's RPC's rental assistance for people in court. Let's just speak about Urbana residents for a moment to make it easy. So if you're an Urbana resident, you're in court, you're going to go to RPC's program, or we're going to route you to that. You are an Urbana resident and you're behind on rent, Cunningham Township is going to process your application if you're not in court, right? Or you have a 5 or 10 day notice. And then we'll look at it and decide, does it make sense for it to be referred to Bridgewater Sullivan Life Center? Or does it make sense for us to address it? And we have screening criteria for how we fork those. But we tend to send people to Bridgewater Sullivan Life Center because they have a lot more money and access to money. And so essentially, but you have to be COVID impacted to receive that rental assistance. So if it's just that you get a disability check that doesn't make the rent, then that makes sense. Then Cunningham Township would be the provider. But if you're COVID impacted and the dollar amount is significant, then we refer. And they just got an additional allocation of dollars as well. So we'll continue to do those referrals. So right now I feel like we're in good shape. You know, I would prefer a complete eviction moratorium, but I think barring, and we have requested that, and I know you all have requested it, but barring that, I think we're doing the best we can.
Thank you.
Any other questions? Okay, thank you. I don't think there's any unfinished business. Move on to new business.
Great. So I've asked Claudia Lenhoff, who's the executive director of Champaign County Healthcare Services, Champaign County Healthcare Consumers, to come and be with us tonight. And essentially, Healthcare Consumers and Cunningham Township have been partners for many decades. And then during my tenure, we've increased that partnership such that anyone who is applying for general assistance is referred to Healthcare Consumers if there's any issue with Medicaid, SNAP, TANF access. And then after they get on general assistance, we also do referrals for anyone who's struggling to find a primary care provider, anyone who needs dental or eye care, anyone who needs prescription drug support, because there's oftentimes a copay, even with Medicaid, providing that support. So Healthcare Consumers is basically, as I think you all know, healthcare services is a very specialty area. It's hard enough to track housing, much less healthcare. And so what the lane that Township has really tried to occupy is the housing lane, because it's the greatest unmet need. And then we have pivoted, as you know, for this year of using the MOU process to really concretize our collaborations with our partners, to make it clear exactly what our expectations are, what they're going to provide, and what the compensation would be. So we are mid-year at this point, partly due to pandemic circumstances. If Claudia and I could have gotten in the same room earlier, we would have. But we did, with the first of the year, circle up because this is a service that we need and that we want to continue to rely on. And so we talked about how we could really deepen our partnership to provide much more coordinated referrals between our organization. So essentially what we're asking is that out of that $100,000 other grants line item that we set aside in the budget, that the town board set aside, what we would do is provide $16,000 of navigation services in this calendar year. And then we wanted to add to the prescription drug and medical equipment pot, partly because sometimes that drains down and we're not able to support them. And then we use angel donor funds. But honestly, because Healthcare Consumers has a much better understanding of the prescription, like what prescription drug coverage exists, and there's a lot of different tricks to the trade. We'd much rather, when someone needs prescription care, to send them to Healthcare Consumers. So we've also suggested that we do reimbursements not to exceed $1,500 for the calendar year. So essentially anything that's paid for by an Urbana resident, they would then submit that to us. And I believe we're doing quarterly payments. So the MOU is attached. It lays out what the services are and what the conditions are. Some of it is boilerplate from all of our MOUs. And it also estimates 150 residents in Urbana will be served with navigation services, and about 25 residents per quarter would be, these are per quarter numbers, 150 per quarter, so 600 for the year, and about 100 residents for the year for prescription drug support. And I would like to invite Claudia, if you'd like to lend your voice to the conversation, and then also Claudia is here to answer any questions about the services of her organization. So Claudia, do you want to chime in and we can take questions?
I'd like to just make sure folks know that what's on the table or will be on the table is resolution number T 2022-02-002R, which is a resolution authorizing the supervisor to sign an agreement with Champaign County Healthcare consumers for healthcare assistance and navigation services. So we'll take questions for Claudia, and then I'll take a motion to get this for consideration. Any questions? Mary Alice.
Hi, Claudia. It's nice to see you here again. I have two questions. My first question is, I know in the past when we've done the consolidated social service funding, one of the items was that you were providing hours at Salt and Light. And now with COVID, which brings into my second question, I'm wondering if that continues or how your services have changed under the COVID.
Yeah, that's a good question. Our services are hybrid right now. Our office is not open for walk-ins or for clients. So we are serving a lot of clients remotely in whatever way works best for them, whether it's over the phone or email or Zoom or snail mail and things like that. But the other thing is we are actually more mobile now, going to more places where people need help. And like over the past year, we've spent a lot of time at motels in Urbana with clients. We had some funding from Urbana, thankfully, that helped to house medically fragile individuals who we were then working with to make sure that they got into the RPC system for housing vouchers. But then we could also work with them on, healthcare and prescriptions and things like that. And we've been to different fairs like at Shadowwood and different places like that. So yeah, not so much at Salt and Light, but other places. And we also just got funding from the Community Foundation of East Central Illinois for a grant that we applied for funding so that we could have more mobile equipment so that like, for example, this spring, if we go to a fair, like a health fair or just some kind of community fair in one of our local community areas, we can actually start working with people to start submitting applications right then and there rather than just scheduling an appointment and then following up later. So so we're doing both, but I would have to say that during the pandemic, we've actually gotten out into the community a bit more than we had before when our services were very much, more based, at our office or different locations like that.
All right. Thank you.
You're welcome.
Any other questions? Grace.
Thanks. I think this is another great thing to do and worth investing in. And I just had a question about the prescription drug coverage, because it comes out to just about $15 a person then on average. And I'm just wondering if that is, reasonable enough for the expected costs.
Yeah, thank you for that question. Yeah, sometimes we have people who just need help with copays. So it might be a low dollar cost, like $3 or $4 or $8, depending how many prescriptions they have. Medicaid has gotten better about covering the whole thing rather than requiring copays. But there are some plans where people have some copays. Now, every now and then we end up with a really big ticket item. And as some of y'all may know, there's certain kinds of prescriptions that are just really, really costly all the time, like inhalers. Inhalers are just ridiculously expensive, sometimes even with health insurance. And then and certain eye medications and things like that, or psychotropic medications, different things like that can be really expensive. So sometimes we have really big ticket items, and then other times we have a lot of small ticket items. One of the things that we do to sort of keep our fund going is that if we get a client referred to us, so let's say, for example, that we get a client referred to us from Cunningham Township, they are uninsured or they just found out that they don't have insurance anymore, which happens to people all the time, especially with Medicaid. The state of Illinois has contracted with Deloitte for the eligibility system, and all of Deloitte's programs are really, really glitchy. And so people will get dropped from Medicaid and not even know it. They usually find out when they go to the pharmacy and need to get a prescription and they find that they no longer have coverage. So for example, if we get referred, if we have a person referred to us by Township who needs prescriptions, but they also need Medicaid, if their prescription is really pricey, we'll go ahead and pay it and get them set up with their prescription, even as we're working on their Medicaid, reinstatement or application. Now, Medicaid has a look back period of 90 days. So if somebody had incurred costs in the 90 days prior to getting doing their application for Medicaid, you can actually go back and have Medicaid pay for those costs. So we're fortunate to be able to work with the OSF outpatient pharmacy that's in the OSF hospital, but it serves the outpatient clients. And they are very much willing to let us go back to them and ask them to bill Medicaid for a certain prescription that we already paid for, and then they will reimburse us. And so that's a way of kind of stretching our money and making sure that it works. And so now, if we had been having this conversation 5 years ago, prior to the big expansion of, Medicaid, for example, I would have said, no, that is not enough. I mean, we're grateful for whatever we can get, but no, that would not be enough. Things are really different now, thankfully, but there are, some people do fall through the cracks and do need that help. But we have a way to, to make all of that work and to replenish the funds.
Thank you.
Any other questions? Chandra.
Hi, just a clarification question. I was reading through the resolution, and there are these funds and this program going to be for this calendar year, or is it for 2021? Because they're like both years in the resolution, so I just wanted to clarify.
It should just be 2022,
Okay.
which is the year we're in, but my brain is sometimes stuck in 2021. I don't know where 2021.
I know what you mean, but yeah, it's the second to last whereas and in the now therefore.
Okay. Yeah, no, that should be yeah. So actually you said the second, so that and in the therefore be resolved should be 2022.
Okay.
Both of those. So if when you make the motion, you could move that the numbers are for 2022 calendar year, that would be great.
Can I add one more thing?
Sure.
Just real quick. One of the things that I wanted to mention is that, and some of you already know this, and Danielle certainly knows this, but one of the things that happens when we work with people and we help them, for example, to apply for Medicaid, they need a lot of help throughout the rest of the year, because when somebody qualifies for Medicaid, they will then have to choose a managed care plan. They need to choose one that works for them, for their provider, but also to cover the prescriptions that they use. And so there's a lot of work that goes into that and making sure people are set up for that. And then also making sure that they know how to access primary care and all that. But then also, as I mentioned before, the Medicaid, frankly, all the states like Medicaid and SNAP, all of those systems are pretty glitchy. And so people will encounter problems. They will get dropped. They will lose their benefits. It's fairly easy for us to get that reinstated and get them reinstated with their benefits, but it happens a lot. And so every new client that we take on, we end up basically, it's hardly ever a one and done. It becomes part of the sort of staple of clients who we serve, and we will probably serve them multiple times a year just because of the way that things work or don't work.
Okay. I think we're ready to entertain a motion.
I'll move to approve resolution number T-2022-02-002R, a resolution authorizing the supervisor to sign an agreement with Champaign County Healthcare Consumers for healthcare assistance and navigation services.
Second.
Moved by Chandra, seconded by Chris, and we'll make sure that changes include changing the dates to the calendar year 2022 where relevant. Further discussion? Okay, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Colacetti,
Yes.
Mr. Quisenberry,
Yes.
Ms. Bishop,
Yes.
That
Ms.
motion passed.
Wilkin,
Oh, sorry.
Ms. Wilkin.
Yes.
Thank
That
you.
motion passes. Thank you, Claudia.
Thank you all so much. I really appreciate
Yeah,
it.
thank you so much, Claudia, for your time, and please share with your staff our appreciations.
Thank you. And not to be rude, I'm going to jump off. I leave to travel tomorrow morning. So thank you so much.
Safe travels.
Thanks.
Take care.
Bye-bye.
Next up is Resolution T 2022-02-003R, which is a resolution authorizing the supervisor to sign an agreement with Watts Copy Systems Incorporated for color printer and copy services.
Yes, so actually, I guess you might want a motion on the table first, and then I can read them.
Okay, is there a motion to approve?
Sure, I'll make that motion. I move approval of resolution number T 2022-02-003R, resolution authorizing the supervisor to sign an agreement with Watts Copy Systems Incorporated for color printer and copy services.
A second.
Moved by Mary Alice, seconded by James.
Just, it's very simple and straightforward. We had a copy system. It was under a 5-year contract. The contract has expired, and essentially we can either renew with the current copying location, but we instead decided to go out to bid, and we found a copy system that greatly reduces our costs and much better meets our needs. Honestly, we had a copy system that was way overbuilt for what we needed. So we are hoping to transfer to Watts Copy Systems. We've selected the copier and are just waiting on your approval to get it installed.
Mary Alice.
So I have 2 questions. My first question is, you had mentioned that there was considerable savings for this contract. Do you have an approximate percentage?
Yeah, I think that it's going to come in at about a third of what we were paying, both for copies and for a monthly contract. It's
Okay.
significant.
Then they have this, I realize it's only pennies, but they have these 3 tiers, right? Tier 1, tier 2, tier 3. And I couldn't find any explanation in terms of what those differences were.
Is that based on saturation or how much color is used?
So that's the 0 to 4%, 4.1 to 10%. That's the saturation.
That's what I was guessing when I read it.
I believe that's correct for the color. And this is much, much cheaper than what we were paying. The color in particular is where we save. It's also the case that we can control, and people will sometimes print in color and they don't know they're doing it, and it ends up being very expensive. So with the new system, we can actually control whether people print in color. So they have to force it to be in color. It can't default to that. Honestly, most of our will also just receive a lot of savings from that problem being solved with this new copier. So more than you would want to know about copiers, but it does make a difference. It really adds up.
I would just add that I've seen a lot of these contracts, and this is really favorable given the amount of volume it looks like you guys do. It's really, really a good deal.
It's also a woman-owned business that's local. And so we when we go out for bid, we have a certain criteria and screening. So it's not only far less expensive than the others, but local and female-owned.
Okay. Grace.
Thanks. Sorry, I'm not familiar with this kind of contract, so I'm just trying to understand. This would be that you have the physical printer, copier, scanner at Township, right? And then they also come and service and bring the ink and all that. Is that right?
Yeah, it's basically full service, which is what we have now. And there's service agreements where if it breaks, it can be fixed immediately. And if it breaks irreparably, we get a new copier without having to make payment. So.
You provide the paper, right, Danielle? That's a separate.
Yes, we purchase the paper, and they provide the toner, I believe.
I think we're ready to vote. Will the clerk please call the roll?
Mr. Quisenberry,
Yes.
Miss Wilkin,
Yes.
Miss Bishop,
Yes.
Miss Colacetti,
Yes.
Miss Wu,
Yes.
Mr. Evans.
Yes.
That motion passes. Last item on the agenda is resolution number T 2022-02-004R, which is a resolution in support of HB 2775, barring source of income discrimination and protecting rental assistance recipients.
Yeah, and I also sent you an updated flyer in your email about this. I just got it this afternoon. They continue to add co-signers, so I wanted you all to have the latest in that. I'm gonna pull that up. See. Okay, so the resolution as written, basically, source of income discrimination is when a landlord says, I don't take Section 8, or I don't take vouchers. But they could also say, I don't take COVID rental assistance, or I don't take township rental assistance. Cities of Chicago, Urbana, and several other in Illinois, but those are the two notable ones, essentially prohibit source of income discrimination already. Both cities obviously have robust rental markets. We don't necessarily prohibit discrimination against folks for receiving rental assistance, so that's an added value for folks in Urbana. It also so essentially what we see in Champaign County is that we let me just lay it out very clearly what it looks like. A homeless resident, we help them get all their documentation in order and apply for a COVID housing voucher. They go through a rigorous process, they intake, they get their voucher. They have 90 days to find housing. They begin to search for housing. And they are told when they go to Champaign, we don't take vouchers. And in Urbana, if they're told that, we call Carla Boyd, she helps us out. But typically in Urbana, we've done a lot of education and we've started to really turn the tide on that piece. So I think Urbana landlords understand that. But what happens is that they time out because they're looking for a place to live. They are discriminated against. I will say sometimes, in some instances, it is racial discrimination disguised as source of income discrimination, right? So when you allow that layer, you can come up with a reason to exclude someone, and we see that as well. But essentially, their voucher times out. If their voucher times out, they can ask for extension, but essentially, at some point, there's no more extension, and they lose their voucher. And this is a kind of I wouldn't say once in a lifetime, but it's a really unique situation right now that we have these vouchers circulating in the community. In addition, there are housing choice vouchers. And we have a record number of people in Champaign County right now circulating with vouchers. I have tracked the numbers when I was a Housing Authority board member. Every month I would track on a chart how many people were circulating. Now, of course, some of them had just gotten their vouchers, so it doesn't mean they always were facing discrimination. But the number jumped from 50, 60, it's now at 120 families that are circulating with vouchers who can't find a place or who are circulating and in some cases are having a hard time finding a place. It's the middle of the year. We see for rent signs throughout Champaign, Urbana, right? It's not the most opportune time, but they should be able to find housing at this point. So essentially what we're asking is for the Cunningham Township Board to lend its voice to the State of Illinois initiative to pass House Bill 2775. It's passed the House, it's before the Senate. Both Carol Emmons and Senator Scott Bennett are co-sponsors in the House and Senate. And it looks like we need about 5 more senators. And every single body that lends their voice to this helps Housing Action Illinois and HOPE, Center for Fair Housing, which are the two groups that we work closely with, push this bill across the finish line. So I would ask you not only to consider passing this bill this evening, this resolution, which would then add our name as Cunningham Township, but also individually as elected officials for you to each add your own names. And I sent a link out a few hours ago for you to do that. So if you feel so moved, I would ask you to also consider signing on. I think it helps to hear from us, one of the few cities that does have source of income protections, that it's not a problem for us, right? So I think actually Urbana is uniquely positioned to really speak up and out on this issue. And if you have any connections in the Senate, I can send you a list of our targets in case you have friends in the Senate, because we have a couple of folks both in the Black Caucus and in rural areas who we are really trying to move on this issue. So, there's one other thing I wanted to add. I was mentioning the housing choice vouchers and people circulating. My understanding from David Northern, he explained this to me, is that I said, why don't we have more housing vouchers in our community? We have the money. I'm looking at our audit report. Why aren't we not moving more housing choice vouchers? And he said, HUD limits how many vouchers, how much money for vouchers we can access if we have people circulating. So we actually have dollars that we could bring to our community for affordable housing to move people who are entitled to vouchers into housing, except we face barriers, and source of income discrimination is one of those barriers. We could actually house more people, and the dollars are sitting on the table in Washington if we were to house more folks. And the constraints throughout the county and Champaign are a part of that problem. And I've certainly spoken to the city council in Champaign. They're sick of hearing from me on this issue. And I'd like to see it happen at the state. If the city is not going to move, then I think the state should. So I would ask for your support on this. I'm happy to answer any questions you have.
We get a motion to get this on the table, please. Chris, did you want to make the motion?
I don't have the motion in front of me, Diane, so if somebody else could.
I'll move resolution number T 2022-02-004R, resolution in support of HB 2775, barring source of income discrimination and protecting rental assistance recipients.
I'll second.
Moved by Grace, seconded by James. Discussion. Chris and then James.
Yeah, Danielle, could you address the myth that housing vouchers require landlords to submit to a higher building standard, and that's why they are not taking housing vouchers?
That's a great question. So in the city of Urbana, we're lucky to have a rental registration program, and the units in Urbana are required to be inspected by our property inspectors. The threshold at the level of the housing authority is very similar. It is not dissimilar from the existing inspection process. And we work closely with that inspector. We know him personally, and he's fast and does a great job, and tries to move through the inspections as quickly as possible. So I think there's obviously disinformation about public housing. There's the specter of public housing. What people don't understand is that most people who access public housing are senior citizens or people with disabilities, and that public housing has been in place since 1937, and that it's been a safe, successful program with some bumps in the road in large cities. So I think that in many ways landlords aren't going to face anything different than what they face with the rental inspection program. And frankly, most landlords I know want their properties to be safe. There are a lot of liabilities that come from running unsafe properties. And so the basics that are needed to make sure children are safe and tenants are safe is just good. It's good business all around.
Thank you.
James.
I just wanted to say thanks, Danielle, for working on this and pushing this forward. Too long, some of our neighboring communities have been able to keep people out of housing for whatever reasons they've chosen. They've pointed towards this as the reason for it, and it's not fair. It's not appropriate. It should be illegal, and I appreciate your work on this.
Thank
you. I think, are we ready to vote? Okay. Will the clerk please call the roll?
Mr. Quisenberry?
Yes.
Mr. okay. Ms. Colasetti?
Yes.
Ms. Bishop?
Yes.
Ms. Wu?
Yes.
Ms. Wilkin?
Yes.
Mr. Evans?
Yes.
That motion passes.
Great. I think the chair deserves applause for getting us to closure at 7:00.
We all deserve applause. Thank you very much. And City of Urbana will be sending a letter in support as well.
Wonderful. Glad to hear it. Thank you so much.
Thank you.
Mhm. Good night.
All right, with no further business before the Cunningham Town Board, this meeting is adjourned and we'll begin the Urbana City Council meeting at 7 p.m. as soon as the clerk gives us the sign.